Good evening to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by your keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. C. Sharat Kumar. Sir is MBBS MS UK, DRCOG UK, PhD super specialty in sexuology and infertility at Sarat's Men's Clinic, director of Medivare Fertility Research Hospital. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is contraception in patient with sexual dysfunction, tailoring the choice. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, sir.
So thank you very much for your nice, kind introduction. I'm sorry for the delay in today's lecture. Today I'm going to talk about the contraception in patients with sexual dysfunction. That is, why sexual dysfunction occurs in patients with who are using contraception, and what are the remedies for these things. So first, we'll just brush up our knowledge about the contraceptive methods available. There are 20 different contraceptive methods other than the condom and other methods of contraception, that is coitus interruptus. I am not talking about the casual contraceptive methods. I am talking about the long-term and medium-term contraceptive methods. There are 20 different contraceptive methods, 10 of which are female hormone contraceptives. In short, I will call them as HC. And 8 are reversible contraceptive methods. That is, when they stop these methods, the conception will come back. And 2 are emergency contraceptive methods. So these are the contraceptive methods are available in the market. And the reversible contraceptive methods are combined hormone contraceptives, that is CHCs, progestin only contraceptives, intrauterine contraceptives, IUC is what we call popularly, combined oral contraceptives, COCs, that is also called as the pill. Commonly, when you go to the medical stores, if you ask the pill, they will give this combined oral contraceptive tablets. They are easily available in the market. They are even easily available free of cost in the government hospitals and family welfare hospitals. And contraceptive patch and vaginal ring, these are all the reversible contraceptive methods which are available. And coming to progestin only contraceptives, there are around 3 types. There is dipomedroxyprogesterone acetate, DMPA, dipomedroxyprogesterone acetate. These are depot injections which are available. And tablets are also available. Progestin only tablets, pills are also available. And implants are also available, or single rod etinogestrel subdermal implants. So these are all progestin only contraceptives which are available. And coming to intrauterine contraceptive devices, we have copper only, that is copper intrauterine devices, CU, IUDs, and the hormone coated contraceptive devices, that is levonorgestrel releasing intrauterine system. So these are all the same thing as copper T, but it will be coated with levonorgestrel releasing intrauterine system, that is hormone coated copper Ts. And there are emergency hormonal contraceptives which are available. They contain levonorgestrel 1.5 mg, that is one pill, that is called a single pill. That is 0.25 mg, 2 pill. So either it can be taken as single pill 1.5 mg or 2 pill, that is 0.75 mg. It will be followed by ilipristal acetate 4 hours after 48 hours after giving the first tablet. These are all emergency contraceptives of hormonal tablets available. Permanent contraceptive methods are sterilization, that is tubectomy for men, and sterilization implant for women, and sterilization surgery for men, that is vasectomy. So tubectomy and vasectomy, they are available as permanent contraceptive methods. So what are the effect of these hormonal contraceptives? They are widely used across the world. There are 2 effects, good effects and bad effects, other than the contraception. The side effects are increased prothrombotic and cardiovascular risks. That is, the clotting time is increased, prothrombotic time is increased, cardiovascular risk, estrogen is de-estrogen dependent. So they have been told that by wide variety of studies that the cardiovascular risk is increased by long-term use of the OCPs, that is oral contraceptive pills. Of course, the benefits are there. Cycle regularization with predictable withdrawal bleeding, decreased menstrual flow, and decreased chances of anemia. So the other than contraception, the oral contraceptive pill, what we call, or hormonal contraceptives, have got good effects also. They regulate the cycle of the lady with predictable withdrawal bleeding. That is, we will be knowing when exactly she will have the periods. Decreased menstrual flow, the flow is decreased, and decreased anemia. So because the blood loss is decreased, the anemia will be decreased. So effect on sex. The influence of hormone contraceptive on female sexual functioning is not so clear. Although variations in the plasma levels of sexual hormones could be associated with sexual dysfunction. Friends, as you know, the sexual function is dependent upon the hormonal levels, especially the sex hormones, especially the testosterone and estrogen, and of course, to some extent, progesterone and thyroid hormone. Because the hormone contraceptive devices you change the hormonal levels, there are chances that these changes in the hormonal levels they result in sexual dysfunction. The permanent modifications during menopause are caused by some endocrine pathologies could be directly related to sexual dysfunction in some cases, but not in all of them. Because we are going to vary the progesterone, estrogen, and testosterone level in the body by giving hormone contraceptives, there are chances that the sexuality may change. Hormone contraceptives use seems to be responsible for a decreased circulating androgen, estradiol, and progesterone levels, as well as for the inhibition of oxytocin functioning. Hormone contraceptives use could alter pair bonding behavior, reduce neural response to the expectation of erotic stimuli, and increase sexual activity. So both can happen because we are changing the hormonal level. Either there could be decrease in the sexual activity, or increase in the sexual activity, or there may not be any change. Neutral effect may be there. So there are several studies on this subject. There are contradictory results from different studies regarding the association between sexual function and hormonal contraceptives. So it could be firmly said that additional research is needed. Absolutely, there is no studies to declare that yes, hormonal contraceptives increase the sexual stimuli, or there are no 100% studies stating that yes, hormonal contraceptives will harm the sexual activity, or there are no 100% studies stating that hormonal contraceptives they neither have sexual stimulation effect nor have decreased sexual activity in women who are taking hormone contraceptives for a long time. When contraceptive related female sexual dysfunction is suspected, the recommended therapy is the discontinuation of contraceptives with consideration of an alternative method such as levonorgestrel releasing intrauterine systems, copper intrauterine contraceptives, estrogestrel implant, or permanent sterilization of either partner when future fertility is not desired, or a contraceptive ring. So, alternative to oral pill. I am talking about oral pill because most of the time contraceptive means the pill, that is the both hormones will be there, estrogen and progesterone. That is the usual meaning of the pill. I'm talking about them, and the considerations are alternative methods. These are all the alternative methods available. Coming to vasectomy or tubal ligation, as a non-hormonal contraceptive method, the effect of sterilization on sexual function extends beyond a simple hormone effect into psychological aspect of permanent pregnancy prevention, whether positive, that is relief or comfort in the knowledge that sexual activity will not result in the pregnancy, or negative, that is regret that pregnancy is no longer positive. So a woman who undergoes vasectomy the sexuality may change. One thing, it may change positively because now she's not at all worried about the outcome of the sexual activity, that is pregnancy, unwanted pregnancy. So she may start enjoying the sexual activity. Her libido may increase, her desire may increase because now the sex is welcome in her. Alternatively, due to some reason, if she wants the pregnancy again, it will have 100% negative effect because now the sexual activity will not make her to become pregnant. So, in either way, vasectomy can affect the sexuality or it may remain neutral also. Neither it increases her sexual activity nor decreases the sexual activity. Coming to non-use of contraceptives, female sexual function is a complex, multifactorial, and is influenced by many biological, psychological, and environmental factors. Therefore, a complete understanding of women's sexual function requires the individual assessment of these factors. Consequently, sexual function does not have to be associated with hormonal contraceptives. So, friends, here is the takeaway message, that is, the non-users of contraceptives have got equal number of sexual dysfunction in women, and those who are using the contraceptive methods also may have the same number of sexual dysfunction. So, taking this into account, the use of contraceptives may neither have the cause positive effect nor have the negative effect. So, coming to management strategies for sexual dysfunction secondary to hormonal contraceptives. If you have decided that the lady has got decreased desire, that is hypoactive sexual desire disorder, after taking the hormone contraceptives, then this is the flow chart what you can take. So, if the complaint is new, that is before using the hormone contraceptives, she was sexually perfectly okay. Now, after the use of the oral contraceptive or whatever the method of contraceptives she is using, she gets the sexual dysfunction. Then, thorough clinical history to rule out other possible causes should be taken into consideration. That is, if multiple contributing complicating factors are identified, then she requires 100% totally different approach, that is multidisciplinary approach, consultation with other professional sex therapist, pelvic floor physical therapist, sexual health specialist, sexologist, then or go for a lifestyle counseling. So these are the available options if the sexual dysfunction is associated with the contraceptives. And second thing, if the contraceptive tablets are related to female sexual dysfunction, if you feel that really hormone contraceptive tablet or device has resulted in female sexual dysfunction, then the first option is, of course, discontinue the contraceptive pill or tablet or device. Consideration of an alternative method, that is use of progesterone only, is use etonogestrel implant, or go for permanent sterilization, or go for contraceptive ring, or go for formulation with shorter hormonal free level, or go for novel contraceptives without affecting the hormone system, that is use condom or the coitus interrupters or other methods. So if you feel really that the lady has landed up in the sexual dysfunction purely because of this hormonal contraceptive device, then these are the options available. Other alternative options to improve the hormone contraceptive related sexual dysfunctions are whether use vaginal lubrications or use moistures. Other possible pharmacological strategies are use exogenous testosterone, yeah, exogenous estrogens. You give DHEA tablet, give tibolone if she is in the postmenstrual this one, use bupropion, or go for sildenafil citrate, that is the Viagra or the what sildenafil tablet, which we use for the male sexual dysfunction. If other causes of sexual dysfunctions are identified, treat those causes. So, friends, this is the the chart of the day. That is what you can do if a lady lands up in the sexual dysfunction after the use of the contraceptives. Either you can discontinue them, or go for alternative methods, or go for, along with the tablets, that is along with the treatment, go for methods like use of vibrators, lubricants, moisturizers, or go for additional methods of treatment. Use exogenous testosterone, estrogen, DHEA, tibolone, bupropion, or sildenafil. And if the cause is known, if the cause for sexual dysfunction is known, then treat that cause. So, information that should be collected in medical record by health providers in response to a complaint of sexual dysfunction is it current or past psychiatric disorder, medication use and health problems, history of emotional, physical, and sexual abuse, beliefs and attitudes regarding sex, menopause, and aging, body image concerns, symptoms of depression, anxiety, and sleep problems, alcohol or drug use, substance use disorders, health or sexual problems affecting the woman's sexual partners, relationship discord or communication issues. Setting aside time to connect with your partner, that is the lifestyle modification. Increase the woman's exposure to sexual stimuli, erotic literature or films. Encouraging maintaining a sexual healthy weight. Ensure, that is, if the lady is obese, lose the weight. If she's too thin, put on the weight. Ensuring adequate physical activity and sleep, regular exercise, walking, cycling, swimming, jogging, or dancing, or yoga, meditation, some physical activity, and good sleep habit. Enhancing skill to cope up with the stress, that is meditation, yoga will help. Recommending books women can use for self education. So, friends, to conclude, hormonal contraceptives could influence different aspects of sexual function. Either they can increase or decrease, or no effect. There are contradictory results between the different studies regarding the association between sexual dysfunction and hormone contraceptives. So it could be firmly said that additional research is needed in this field. Hormone contraception has been associated with different alteration in sexual functioning. When we address a new sexual complaint that is time related with beginning of a hormone contraception, healthcare providers should give information about other methods available and try to switch them to a method less associated with sexual dysfunction. That is, reduce the dose. That is the main thing. And vaginal rings and patches are possible options in case of women preferring combined hormone contraception who report side effects with the pill, because the vaginal ring and patches and intrauterine contraceptive device with the coating of the hormones doesn't have much side effects because they don't enter the stream, that is the bloodstream. So alternatively, you may switch to these methods. Multidisciplinary approach to the management of female sexual dysfunction is mandatory. The healthcare provider should give lifestyle counseling apart from proposing different treatment options. Adequate relationship with patients as well as routine monitoring of possible sexual dysfunction are essential in addressing these difficulties. Undoubtedly, the best contraceptive is one that fulfills the woman's needs with acceptable side effects and agreed with the prescriber. So, as long as the woman is happy with the the contraceptive method, the hormone method you are given, fine. If she is not happy, if she has got some sexual dysfunction associated with the use of these HC, then you have to change it. Either change it, or reduce the dose, or go to different method, or use adjuvants as like testosterone gel, or estrogen gel, or test the sildenafil tablet, tibolone tablet, flibanserin, or bupropion. These are the available methods. So thank you very much for your kind attention. Once again, I am sorry for the delay in today's lecture. I was held up in the traffic, as you know, as is the routine excuse we give. So over to the moderator. IJCP has given us an opportunity to exchange our medical knowledge with the professionals all over the country. They are doing extremely good. The Meditalk has become a talk of the town, talk of the day, and talk of all the medical fraternity. So over to Ankana, over to the moderator over is Dicky, I think.
Thank you, sir. Thank you so much for this wonderful.
I didn't get your name.
It's Srion, sir.
Yeah,
SRION.
Shyam, thank you very much. Thank you. So
Thank you,
over to
sir.
you. Shall I close the screen?
Yes, sir. You can stop sharing the screen. We do
Yeah,
have some question from our audience.
yeah, yeah.
If you like to
Sure,
take that
sure.
up.
Yeah,
So, sir, the first question is, how
yeah.
important is it to regularly review and adjust contraceptive method in patient with ongoing or evolving sexual dysfunction?
Yeah, very good question, Sriyan. So the most important thing is whenever you start the contraceptive device in any woman, she will have some anxiety. She will have some apprehension. Yeah, will it affect my sexual health? Will my husband continue to have the same amount of sexuality with me or not? Is it going to affect my sex? Nowadays, the ladies have become more aware about the need of the sexual activity in their day-to-day lifestyle. So that this is the first comprehension. Then they ask the doctor, you have to very clearly tell her that absolutely no, these hormone contraceptive devices doesn't have any effect on the sexuality. If at all, if it is there, it may increase the sexual activity. And very rarely, very few women have reported decreased sexual activity. And that decreased sexual activity may not be really connected with the contraceptive devices and contraception tablets or injections or patches we are given. So absolutely don't worry, please continue. If she still reports decreased sexual activity even after the use for 3 to 6 months, then only if you think really that that is the only thing, then treat it. Or ask her other comorbidities. What else change in has occurred in her? Why sexual dysfunction can occur? You have to tell her that sexual dysfunction can come into any woman. Women who are not using this hormone contraception can also get the sexual dysfunction. So try to identify the cause for the sexual dysfunction, and if you can get the cause for the sexual dysfunction in her, treat that cause rather than discontinuing the hormone contraceptives. Because I don't really agree that the sexual dysfunction is due to the hormone contraceptive only, because hormone contraceptives have got several good effects. Also, they have been reported that some women enjoy the sexual activity more after starting the hormone contraceptions. So, contraceptives will help the woman, not decrease the libido or desire. If you still think that that is the only cause, then change the hormone contraceptives. So, that is the only thing what we can do. Yeah, over to Sriyan.
Yeah. So, the next question is, are there any specific contraceptive option that may enhance sexual health or body image in women struggling with these functions?
Yeah, the combined pill is the best one. Though both estrogen and progesterone, combined pill will give her, because estrogen is also there, that will enhance her sexual activity. Her desire will be maintained. Her vaginal wetness is maintained because in the first half of the cycle, estrogen is added in the OCP. That is we called as combined pill. In the second half, progesterone is there, which will take care of her in the second half of the cycle and gives her the perfect timing of the periods, and the blood flow is decreased, anemia is decreased. Once the anemia is decreased, once the blood is increased in her body image increases, her body color becomes more reddish and pinkish because she is no longer pale. Her cramps during the menstrual cycle are decreased. Her premenstrual tension is decreased. Her tension about becoming unwanted pregnancy is decreased. Her anxiety during sex is decreased because she need to worry that, oh, I may become pregnant, and what if I become pregnant. So if in the corner of the mind, if that thought occurs during the sexual activity, that will inhibit her further sexual activity. So using the hormone contraceptives will increase the body image, because the she no longer have got that PMS, premenstrual syndromes and cramps, because the estrogen and progesterone regulation will change her menstrual cycle perfectly. She will get the periods on the perfect day. The menstrual flow is not 5 days, 7 days as earlier. No menorrhagia, no metrorrhagia, no bleeding in between the two cycles, because the estrogen and progesterone will take care of the hormones, and there will be no mid-cyclical bleeding, and there will be no mid-cyclical cramp due to ovulation, that is chimerism. That is, on the day of ovulation, some women get muscular spasms in the pelvic region because of the ovulation. That is not there, because ovulation is stopped by the contraceptives. So these are all the advantages of using the contraceptives, and definitely it improves the body image and sexuality in the woman.
So
Okay,
there's
Shreya.
one last question,
Yeah.
which is in patient with pre-existing sexual dysfunction, which contraceptive methods are most likely to worsen versus improve symptoms?
Can you please repeat?
Sure. So the question was, in patient with pre-existing sexual dysfunction,
Okay,
which
okay.
contraceptive methods are more
Yeah,
likely to
yeah,
worsen or
yeah.
improve? Yeah.
Excellent. Very good. It can be called as the question of the day. The answer is there in the question itself, because it is pre-existing sexual dysfunction. That means she has got sexual dysfunction. It has to be treated as a sexual dysfunction, and proper interrogation, that is counseling, has to be done with both the partners. Find out the cause for the sexual dysfunction. Why this lady has got this sexual dysfunction? Is it psychogenic, whether it is purely anxiety, or is it due to some stress, or due to obesity, or due to any other comorbidities like hypertension or diabetes, or is it due to the tablets that she is taking for some other disease? She may be having arthritis, she may be taking continuously painkillers, she may be having hypothyroidism, she may be taking tablets for the thyroid, she may be diabetic, she may be taking anti-diabetic tablets, especially hypertension, she will be taking anti-hypertensive medicines. She may have some stress or neurosis or psychosis, she may be taking psychiatric tablets. Most of them, they are antidepressants or anti-anxiolytic agents. And friends, most of the medicines which are taken by the person who has got several metabolic disorders, most of them, they cause sexual dysfunction, especially psychiatric medicines, antidepressants. They cause the decreased desire, HSDDD, that is hypoactive sexual desire disorder, is common in women who take most of the times these anti-anxiolytic medicines, and also medicines for the hypertension. Most of the antihypertensive drugs do have certain amount of decreased sexual activity, except of course telmisartan. So other drugs, they do have some negative effect on the sexuality of the person, both in men and women. So any other chronic illness, tablets taking for cancer or tuberculosis or psoriasis, they do have negative effect on the sexuality. And continuously taking these analgesic tablets, they do have negative effect on the sexuality. So find out the cause, whether it is psychogenic or iatrogenic or medicine borne or purely interrelationship problem, fight between the partners, husband and wife. She may be having perfect sexual activity with her lover, but may not be with the husband. There may be some family fights, or some amount of interrelationship problem. They have to be sorted out by counseling, and see that she goes along well with the partner. And the relationship with the partner, the partner's response to the sexual activity is also equally important. Unless he initiates the sex with the lady, she may not get stimulated. She may require longer time for stimulation, and for precoital foreplay. So romance and other things are very, very important. So how the partner behaves with the lady is equally important in the sexual activity. So these can be sorted out by counseling and treating the cause properly. So a lady who has got sexual dysfunction before the hormone contraceptive pill, she needs to be attended as it is and where it is as a sexual dysfunction. Coming to the hormone contraceptives, the best tablet will be the oral contraceptive pill, OCPs, or any the method which contain both the estrogen and progesterone, because estrogen is going to help her to improve her sexual activity. Or contrary to that, if progesterone only method of contraception is used due to some reason, then additional estrogen gel, which is given as a gel form, which can be just put over the vagina every day or first 14 days of the cycle, that stimulates the vagina and lubricates the vagina also. And low dose of testosterone, that is zero point 0.5 mg testosterone patches or gel applied daily in the first half of the cycle for 10 to 20 days. It will increase her stimulation, because testosterone is the best stimulant. And also giving low dose of sildenafil citrate, 25 milligram vaginal tablet, inserted into the vagina 1 hour before the starting of the intercourse, that is the during the foreplay. The sildenafil citrate increases the blood flow to the vagina and also to the clitoris and gives stimulation. And using moisturizers or lubricants also help her to come out of the sexual dysfunction while taking the contraceptives. And use of the vaginal vibrator, vibrating the clitoris and the labia majora, mons pubis, and labia minora before the intercourse. It stimulates her and makes the vagina wet. So, along with the use of contraceptives, if she goes for these physical methods, that they help. And the last and not the least, lifestyle modification, doing regular exercise, regular yoga, meditation will help her to improve her sexual activity, because for example, dancing, skipping, jogging, cycling, or any other walking, any other exercise, that they release certain amount of androgens. Low dose of testosterone is released. Testosterone is equally responsible for sexual activity in both men and women, though the dose is less. So, as a small amount of DHEA released and androgens released during the exercise improves the sexual activity in the woman. So, these are the methods available for a lady who has got predisposed sexual dysfunction before the use of contraception. What is Sriya?
Thank you so much, sir, for answering all our questions. That's all from our audience, sir. Before concluding, any take-home message from your end?
Yeah. The message is uh, be careful before advising permanent methods of contraception, that is vasectomy and tubectomy, to the couple, because I've seen innumerable number of couples landing up with secondary infertility, losing their kids by accident, by due to some disease or due to some unforeseen conditions. And again, if they want to become pregnant, it will be almost impossible to get their fertility back. And if especially if they have got only one kid, never advocate them the permanent methods, because permanent method will totally damage their tubes, and they may not become pregnant again. They may have to go for tubal recanalization, which is not 100% successful, or they may have to go for IVF, which is not 100% guaranteed, and also it carries lot of money and inconvenience and surgeries involved. So never advocate the tubectomy or vasectomy in couple who have got only 2 kids. Of course, unless they have got 5 6 kids, when the question of secondary infertility doesn't arise, you can definitely cut off the tubes. Otherwise, always ask them not to undergo this, because our past experience says that couple who have got the 1 or 2 kids only may land up in problem in future days. And couple who have got only one gender kid, that is either male or female, later on they may want another boy or girl. For example, a couple who has got only one boy, and due to some reason, if they go for vasectomy or tubectomy, as the boy grows up, he will start demanding, I want one more sibling, that he wants another companion, that is either a boy or girl. I want somebody, I'm alone at home. At that time, if the couple thinks of having a second child, then it will be almost very, very difficult. They have to go for IVF, which is not 100% guaranteed, involves lakhs and lakhs of rupees, and also tubal reclination is not that successful. The success is only 40%. So the takeaway home is, ask the couple to have the kids as early as possible, as soon as they are married. Have the couple to have more than 2 or 3 children, so that in future they won't suffer from secondary infertility. And ask them to have the second child within 3 to 4 years, not to postpone the second child for more than 4 years, because of the age they land up in the secondary infertility due to aging, especially if the woman after the age of 35, 40, it will be very difficult for her to become pregnant because of the age factor. So before advising the contraception, ask them to have the first child as soon as they are married, second child within 3 to 4 years, and let them complete the family first, then think of the contraception. And during the contraception also, ask them to have only the temporary methods of contraception, not permanent vasectomy or tubectomy. This is the carry home message.
Thank you so much, sir, for joining us today. It's a pleasure to have you here, and thank you for conducting such wonderful session.
Thank you. Thank you very much. I sincerely thank the IJCP people who try very hard to get us and do these sessions. And they call us several times, they telephone us, send the messages to see that this session goes on. In spite of that one, we doctors, we sometimes lag behind and be late like this. I hope next time it won't happen. I promise them that such things may not repeat. And I sincerely thank all the doctors who joined me today for this session. And I thank all the viewers who asked very good, appropriate questions, thought provoking, and thoughts, a lot of insight in their questions. I hope I answered their questions and cleared their doubts. Thank you very much once again for all the IJCP team. Good night, Shivaratri.
Good night, sir. Thank you so much.
Thank you.